Hi, my name is Ceci Constancio. I'm doing my research paper on the Rocky Mountain Spotted Fever. Rocky Mountain Spotted Fever is a tick-borne disease that is caused by the bacteria rickettsii. The bacterium is the cause of many deaths in North America and South America, just by the bite of an infected tick. There are 3 types of ticks in the United States that can carry this bacteria. They are the American dog tick, the Rocky Mountain wood tick, and the brown dog tick. Rickettsii is gram-negative and is aerobic. It is a small, obligate-shaped bacterium that is intracellular and lives in the cytoplasm of its host. Rickettsii enters the body of a human through phagocytosis, and this is usually from the bite of a tick. After you have been bitten by one of the ticks, the symptoms may not appear for 2 to 14 days later. 9 times out of 10, you will not even know you were bit by the tick, since it is usually painless. The symptoms of Rocky Mountain Spotted Fever include, but are not limited to, fever, headache, loss of appetite, vomiting, abdominal pain, and muscle pain. A rash will develop on the body in about 90% of the people, but this will take a few days to appear. The other 10% of the people may never develop a rash, but should still seek medical attention for the symptoms that occur. Rocky Mountain Spotted Fever is a severe illness and needs to be treated within the first 8 days, or it can be fatal. The initial diagnosis of Rocky Mountain Spotted Fever is based on the symptoms and medical history of the client. The initial diagnosis can be confirmed by using a special laboratory test. Treatment of Rocky Mountain Spotted Fever should begin immediately after the initial diagnosis. Doxycycline is an effective class of antibiotics against this bacteria. The start of doxycycline should not wait until laboratory test is back. It must be initiated as soon as the doctor suspects you have Rocky Mountain Spotted Fever. The usual doxycycline dosage is 200 milligrams per day that is divided into 2 doses. Treatment should be continued until patients show no more symptoms for at least 3 days. The usual treatment course is 7 to 10 days. Several cases may require intravenous administration or longer treatment duration. Rocky Mountain Spotted Fever has been around since 1920s. Reported cases of Rocky Mountain Spotted Fever have increased more and more over the years. Reports show that in the year 1993, there were only 345 cases, and in the year 2008, there were 2,553 cases reported. The first case of Rocky Mountain Spotted Fever that reported a fatality was in 1940. The amount of cases that cause death has dramatically decreased since the 1940s. The amount of cases that cause a fatality varies from year to year, and in 1944, 28% of cases caused death, and in 2001, it was reported that only about 1 to 2% of the cases caused a casualty. Rocky Mountain Spotted Fever has been reported all over the United States, but there are 5 states that account for more than half of the reported cases. These states are North Carolina, Oklahoma, Arkansas, Tennessee, and Missouri. The culprit for spreading Rocky Mountain Spotted Fever in these states is the American dog tick. Recently, eastern Arizona has had about 140 reported cases between the years 2003 and 2010. 10% of those cases have involved a fatality. The brown dog tick is also responsible for spreading the bacteria. Someone can get Rocky Mountain Spotted Fever at any time of the year, but reports show that there is an increase in cases in the month of April, May, June, and July. Although this is not an accurate time for every region, because every region has different climates and different time spans for when the ticks are the worst. Rocky Mountain Spotted Fever will infect anyone because a tick can bite anyone. although reports have shown that more males, American Indians, and people over 40 years of age are the main ones being infected. Also, people who have constant exposure to dogs have an increased risk of being infected. The reports have also shown that children under the age of 10, American Indians, and people with low immune systems are more likely to get a fatal case of Rocky Mountain spotted fever. Stopping the spread of Rocky Mountain spotted fever is not an easy task to accomplish. If you are the only one who cares in a crowded neighborhood, it will take a community effort. The most important way to stop the spread is to make sure your dog is tick-free. You need to be sure that your dogs have a tick and collar and are getting regular baths with medicated soap. If you are not comfortable with placing a collar on your dog, there is other medicines out there that can go on the back of the dog's necks that will help repel ticks and fleas. Also, for the sake of your family and you, it would not hurt to purchase extra collars that could be put on any strays you see walking around in your neighborhood. Although there is no way you can catch and collar every dog in your neighborhood, especially the dogs that are skittish, mean, and impossible to catch. At this point, all you can do is move on and get the other dogs. Be sure to change the collars every 3 months on your personal dogs. That way they can stay protected and it can continue to kill the existing ticks. Another way is to spray your yard and surrounding areas, especially those closest to wooded areas, with a pesticide. Pesticide will not kill every single tick, but it will decrease the likelihood that a tick can live and sustain life in areas that are sprayed. A key note about pesticides is that they do not kill eggs, so once an area is infected with ticks, you should spray pesticides at least once a month. In conclusion, Rocky Mountain spotted fever is caused by the bacterium Rickettsia rickettsii, which is transmitted to humans through the bite of a tick. After you have been bitten by a tick or start feeling the above symptoms, you should contact your doctor immediately. Rocky Mountain spotted fever can be deadly if not treated right away. Remember to treat your dogs for ticks and take the necessary precautions when traveling to a place that is infested with ticks.